In this episode, I talk with Dr. Teitelbaum and we talk through what causes pain, what is pain, what are things that we could do to support our pain, what is chronic fatigue syndrome and fibromyalgia, and what are things we could do for that, and then information about melatonin, thyroid, hormone, sleep. Do we need to take sleep supports forever? Is sleep really important to get 8 hours? And we talk about all these things that help us get back to wellness. I now eat a lot of meat, and so do they. If you want to thrive, you need to eat meat. Meat is required. Hey guys, my name is Judy Cho and I'm board certified in holistic nutrition, and I have a private functional medicine practice where we focus on root cause healing, and that often starts with the Carnivore Cures all meat elimination diet. Today, I had the pleasure of sitting down with Dr. Teitelbaum. He is a wealth of information and he focuses on getting to root cause healing. Many years ago, he had his own journey with chronic fatigue. He even shares that he was homeless. And in that plight, he focused on getting answers so that he would no longer feel pain and fatigue so that he can get back to wellness. As he learned and grew and studied and looked into so many different areas, he found answers to what can help us get closer to root cause healing. So in this discussion, we talk about so many different areas. We talk about chronic fatigue, what that is, what the source is. We talk about pain and where it stems from. And he shares, most importantly, from all of the illnesses we talk about, even with mold and Lyme and MCAS and Epstein-Barr, he talks about how we can have answers to root cause healing and wellness and how it's possible to actually be pain-free. While we talked a lot more about the biochemical side, as he says, we did touch upon how the mind-body also works in this whole area. And maybe we'll talk about that more in a next interview with him, where we talk more about how to manage pain, even from a mind-body perspective. I hope that this discussion, because it gets pretty tactical for all the nuanced areas, and then he even gives you his contact information that if you are suffering from said illness, here are some things that you could tactically do. So I hope that this conversation gives you a wealth of information so that you can get to root cause healing. Hi, Dr. Teitelbaum. I'm very excited to have you on my channel. For the people that may not have heard of you, if you can introduce yourself to the people that are listening and watching.
Hello, hi everybody. I'm Dr. Jacob Teitelbaum, MD. I've been practicing pain management and treating chronic fatigue syndrome and fibromyalgia for about 50 years now, since I came down with myself back in 1975. I've written 12 books at this point, 8 published 8 studies, 3 medical textbooks chapters. This is a key focus, and it's something that's extremely treatable. The problem is not lack of effective treatment, but rather lack of effective physician education. So that's why I'm here today, to teach you how to, if you have this illness, how to recover, and if you treat people with the illness, how to get them well.
Your own chronic illness journey and with fatigue led you this way. Do you want to share a little bit about that?
I was back in medical school at the time. I was the third youngest in the class of about 300, was paying my own way through med school, accelerating it because you pay by the year, not by the credits. I figured you go through it quicker, it costs less. And all of that was easy, but their family, I was caught in the middle of an emotional family crisis and a Holocaust family, and there was a lot of emotional chaos. And then I got a nasty viral infection, what I call the drop dead flu. And it basically triggered post-viral chronic fatigue syndrome. But the professors couldn't figure out what it was. After 6 weeks, they presumed I was depressed. I couldn't work anymore, so I had to drop out of med school, and I was homeless, sleeping in parks. And it's funny how, even though I felt crushed, my whole life had been geared to being a doctor or a healer, but doctor in those days is the way to become that. Along the way, I met all these different people who taught me nutrition, naturopathy, energy medicine, all these things that I didn't even know existed. And as I learned these things, homeless, sleeping in Park in Tulsa, I learned enough to cobble together a program to get myself well, was able to return to medical school, and have since then, like I say, focused on effective treatment for these conditions. I am a science geek. I treat science as a tool, not a religion, and those are two very different things. And I know the difference between slick pharmaceutical advertising versus science. which is also two very different things, an important distinction in medicine. So I'm happy to teach you how to get well, how to understand the message that your body is giving you.
Okay, I love it. And thank you. Thank you for having that tenacity to fight through so that now you can share and help others. So thank you for that. Let's talk a little bit about CFS. So, how does it relate to fibromyalgia and pain? And is fibromyalgia even a root cause? If you can share.
So what you're seeing are overlapping processes, many of which are the same thing. For most people, CFS and fibromyalgia and ME and long COVID are all interrelated processes. People ask, what's the difference? For those who have pain, the difference is if you go to the immunologist, they'll get a diagnosis of CFS. If you go next door to the rheumatologist, they'll get a diagnosis of fibromyalgia. If you go to most doctors, you'll get a diagnosis, you'll get gaslighted. I don't know what's wrong with you, sir. You must be crazy, that kind of stuff. But they're very much related processes. Fibromyalgia is much more than pain. Chronic fatigue syndrome is much more than fatigue. Basically, in these conditions, you have an energy crisis where you've tripped a circuit breaker. And just like dozens of things can cause you to trip a circuit breaker in your home, same thing in your body. So you need to know how to turn the circuit breaker back on and often how to get rid of what tripped the circuit breaker in the first place.
And then how would you go about doing that?
Well, first of all, if people come in and they say, I'm exhausted, or they say, I hurt all over, ask them one question. Can you get a good night's sleep? And generally the answer is, oh my God, no, I can't fall asleep. I can't stay asleep. No, that combination, the paradox of can't sleep despite being exhausted, you sleep. If you're exhausted, you sleep all night. But that combination says that you trip the hypothalamic circuit breaker. Hypothalamus, almond-sized area in the brain that controls sleep, hormones, temperature, and autonomic function. That's the circuit breaker that's gone offline. So that combination of widespread pain or fatigue with inability to sleep, you've got this process. Now you can have pain without the process, you can have fatigue without the process. So you want to distinguish. All of these are treatable.
What's interesting is where you're saying to focus is the area that is also impacting how the thyroid then gets released of all the different hormones. So would you say that's related? So would you say that CFS is related to thyroid?
Absolutely. Think about it. The circuit breaker controls sleep. So you can't sleep. It controls your hormone system, thyroid, adrenal, reproductive, growth hormone, that whole thing. It controls autonomic function. So you see POTS. You also, when you have MCAS or mast cell activation syndrome, that's coming from excess histamine release in the hypothalamus because of PEA, and we'll talk about PEA later, depletion, which then triggers a cascade. So all of these are on the same circuit breaker. All of these need to address, and what our double-blind randomized placebo-controlled study showed is that you can turn that circuit breaker back on by restoring energy production with what we call shine. So treating the root causes as an overview, optimize sleep, all kinds of ways to do that. It's not that difficult. Address the hormones, even if the blood tests are normal. And then H is also hypotension, treat the POTS, treat the infection and inflammation, and as nutritional support, which is really the foundation piece. And then small e is exercise as able. In the double-blind study, both groups got the exercise. The exercise was not the key reason. It was the metabolic issues getting addressed.
So let's talk about each illness, and then maybe we could talk about how the SHINE protocol then supports all of these illnesses. So the first thing is, if you can just explain how pain works in the body. A lot of times it's somebody gets an injury and then there's a pain and then that pain never goes away in that localized area. But in general, if you have a fibromyalgia type pain, how does this pain cascade work?
So it helps to think of pain as there being a couple of key foundation pieces to the pain. Number one, the low energy causes muscles to get locked in a short position. Muscles are like a spring. It's counterintuitive. You'd think it takes more energy to contract the muscles, but no, it takes more to release. And a good way to grasp that in the mind is if we come home after a heavy workout, you don't say, honey, my muscles are all loose and limp. Give me the back rub. Say they're all tight because they're low energy, Muscles get locked in a shortened position, they hurt. So addressing the muscle pain, which is present in most forms of chronic pain, you need to address the inflammation component, which is not hard to do. If, addressing diet, decreasing sugar, decreasing white flour, increasing oily fish, grass-fed instead of grain. I mean, these are all things that Judy, but, we can balance the inflammation of the body nutritionally. An herbal mix called Curamen, or for practitioners, I think it's called Curafen. It's an amazing mix of curcumin, boswellia, DLP, and nattokinase. All of that and fish oil settles the inflammation right down. So we'll talk about increasing energy from muscles release, settling inflammation. For nerve pain, lipoic acid, 300 milligrams twice a day. Treating the whole process helps. See, chronic pain triggers microglial activation. It's all part of the cascade. It triggers small fiber neuropathy. So when you get chronic pain, you're going to have chronic nerve pain. You're going to have chronic muscle pain. These are all pieces of it. For those of you listening who have severe neuropathic pain, you can email me, and I'll be happy to send you the free book on treating neuropathy. Just note that you have neuropathy or nerve pain for my book, Pain Free 123. It gives a very detailed mix of prescription and natural things, how to order them, the sequence to do them, and it's a very effective program for nerve pain. And then the fourth piece is anytime you have chronic pain, it amplifies what's called brain pain. I keep pointing to this here because this is where the action's happening. You get a depletion of, we mentioned PEA, palmitoyl-ethanolamide. It's like a superhero molecule for handling severe stress. And during chronic pain, chronic inflammation, chronic infections, your brain will put this out because it's kind of like the coordinator that helps, take care of the battle. When that gets depleted, you'll see chronic pain will amplify. You see microglial activation, brain inflammation, brain pain. I'm throwing out different words. Each of you may recognize different labels that has been given. You see the MCAS, mast cell activation syndrome, all of this PEA depletion. So 4 components of pain: improve energy from the muscle pain, and you can do structural other things. Address the inflammation, address the nerve pain, and address the brain pain. You do that, our research shows chronic pain goes away. 1/4 of Americans has gone up. 1/5 of Americans 4 years ago. It's now 1/4 in the most recent CDC research are suffering needlessly with chronic pain. Almost all chronic pain can be effectively treated.
What's interesting is how you're saying that a lot of the pain starts from this area. We've seen that there has been a lot of work with, I think even John Sarno's work about if you focus on mind, body work, nervous system regulation, that also reduces pain. Is that all part of the same system? Hey guys, just a really quick break. Nutrition with Judy's private practice is now called Empower Functional Health. I started as a nutritional therapist, but we have become much more all-encompassing. At Empower Functional Health, we do functional medicine, chronic illness, autoimmune, gut health, environmental illness such as SIRS, mold illness, Lyme. Regardless of all these names, the goal for us is always to get you root cause healing answers. And of course, carnivore, the all meat elimination diet is always on the table. Food, the right food, is always medicine. We offer functional tests, prescription meds, and really everything to get you closer to root cause, where you can just eat the meats you enjoy and live the life that you are meant to symptom-free. The goal is to get off meds, supplements, and everything else that your body no longer needs support in. Our practice, whether it's Nutrition with Judy, sharing podcasts and free content, or our private practice, Empower Functional Health, our goal is to support you guys in the barbell theory. We give a lot of free content, our evidence-based research. We don't use Substack. We give all our stuff away for free. We interview with the best and make it super tactical so you have clinical pearls that you can walk away with and try in your own healing journey. And then we work with some people in a smaller subset, one-on-one, to provide that level of personalized care. And as we heal these people that are chronically ill, we find these clinical pearls and golden nuggets that we can share then more publicly so that we can make wellness for all. Hopefully, the content and the guides and the free stuff we give out is enough for you to heal. But if it's not, you can always come and work with us in our private practice so that you can get more personalized care. If you want to learn more, make sure to check out empowerfunctionalhealth.com.
It's all part of the same thing. If you see, look, John's work, even his original work, looking at the blocking feelings as the pain is way to this kind of draw ourselves away from feelings we don't want to feel. All of these things tie into this kind of a cycle. And there's four key components again. You've got the biochemical, which is what we'll talk about today. You've got the physics, biophysics, which is energy medicine, acupuncture, those kind of things. Even, the microcurrent, all kinds of things for the biophysics. You've got the structural aspects where you can release the muscles that are short, then the pain will go away. And the muscles biochemical, and then it'll go right back down again. It'll help for about a week or two. Then there's mind-body component. So there's all kinds of ways to visualize how to address the pain. The four components they gave originally are for the biochemistry of pain.
Okay.
And there's a bigger picture that includes John's work.
And then in terms of mast cells, POTS, dysautonomia, which I know POTS is a part of dysautonomia, explain how this is all related as well.
So we talk about hypothalamic dysfunction. Hypothalamus controls autonomic function. POTS is dysautonomia. So autonomic dysfunction, and the POTS is one piece of autonomic dysfunction. You'll see gut issues, you'll see sinus congestion. There are many different phases of autonomic dysfunction. And then the PEA, the palmital ethanolide, being depleted it's kind of like the common denominator. There's now over 200 studies looking at this for chronic pain, looking at it for mast cell activation syndrome. And the PEA is predominantly released by the hypothalamus. This is the control center where it's all happening. So again, even though there's MCAS can be treated, POTS can be treated. As I mentioned before, for free information sheet, my email address is fatigue, that's like Frank, APIGUE, DOC, like doctor, fatigue doc at gmail.com. Just let me know what to look for with fibromyalgia information sheet, POTS, MCAS, neuropathy, just specifics, and the information sheets we have. It'll go through detail for the POTS and say, here's pre-tests to do at home. You don't need table testing. It's a piece of crap tests. I'm sorry. It's just horrible. You can do the simple test for blood pressure coverage. It's taking a pulse at home. It's not rocket science. It's not hard to treat. It's a holistic natural prescription thing. Same for the mast cell activation syndrome.
And just for people that are listening and watching that don't know what POTS is or dysautonomia, it's those symptoms that when you get up too quickly, you feel kind of dizzy, you maybe need more salt than other people. It's just where you're, like you said, the autonomic nervous system is not functioning as well.
So for POTS, you think about it, gravity, and we're a big bag of water. We stand up, gravity sends all our blood down to our legs. Gravity does. To become an upright species, we haven't developed the ability to send that blood back to our brain. And that's what the autonomic system does. When it malfunctions, you get POTS. You stand up, your pulse zips up. And they don't talk about blood pressure dropping, but once you can't compensate anymore with a high pulse and blood pressure drops, again, increase salt, increase water, use compression stockings, medium pressure compression stockings, 20 or 30 millimeter. Treat the adrenal issues. There's a nice supplement called Adrenaplex. For the younger population, I find the Florinax and BDAVP medications can help. There's Midodrin. There's a list of over a dozen things that can help. And again, in the information sheet of my books, it's just all listed out.
How do you treat MCAS? I'll tell you a little bit of the people that probably are watching this. Whatever they've been diagnosed with is not working enough. And so then they try a elimination diet of mostly meat. So trying to lower the inflammation from any plant toxins, ultra processed foods. And one thing they notice is that their histamine bucket kind of goes up, or they just notice it more than when they, their immune system was a lot more disorganized and everything was just making them not feel well. But now they're noticing, aged meat or canned fish, and they're having a histamine response. And so nothing else food-wise can they really improve the mast cell response. So what would you do from there for somebody that's eating relatively clean?
So first, you want to distinguish between food sensitivities. Now, food allergies, which technically are IgE, blah, blah, blah.
Okay. Yeah.
That's not what we're talking about here. We talk about we have a sensitivity reaction to food. One of the studies we did was using a NAET, it's a active pressure allergy elimination technique in autism. 23 of the 30 kids in the treatment group were back in regular school after a year versus none of the 30 in the control group. So there are ways to desensitize for food sensitivities. Food sensitivities, you're going to have the same reaction to the same food every time you eat food.
Okay.
That's the hallmark. For mast cell activation syndrome, one day you're going to react to this food, and the next day, no problem with that food, but you react to a different food, and it's just random.
Yes.
That's when you think MCAS. So you can do a little histamine diet. That's at the bottom of my list. It's really hard.
Yeah.
And instead of trying to avoid histamine, again, MCAS is excess histamine release because of EEA depletion in the hypothalamus. That's kind of as root of cause as we know so far. So what can you do? You can use PEA, ethanolide. You can ask for the PEA information sheet. I'll send that to you with the MCAS information sheet. Now you see why I offer the emails.
Yes.
But the PEA, you want a high absorption form. I use one called Healthy Inflammation Response by Europharma. Euromedica, so practitioners has this silver one. 600 milligrams a day, usually on an empty stomach, is what most of the studies use. It's for chronic pain or MCAS cases that are severe. I will give 600 milligrams twice a day for 1 month, and then 1,200 milligrams twice a day for 2 months. The effect could be quite dramatic. Quercetin can be very helpful. Things that block histamine, whether it's Benadryl, the nose sprays that are the histamine blockers, Singular, many medications. So I kind of have a list of medicines that help MCAS and then natural options that help MCAS. Because some people prefer one way, some prefer the other, and some people just mix.
What causes the depletion of PEA? And then secondly, are there any foods that we can support PEA naturally? Okay.
Not so much. The body makes PEA, but it's kind of a slow time consuming chemical process. It will kind of bank it. And PEA is released during severe stresses. Think of it like our firemen or our emergency rescue teams. They're really good at going in if there's emergency response. They go in, they take care of it. But what if you have a World Trade Center going on and they're overwhelmed?
Okay.
That's when things start to go to hell. Same, we can handle a certain amount of stress, but when it gets beyond that, then suddenly our usual coping mechanisms tend to get overwhelmed, and the immune system and the histamine system start to go haywire. So it's the reflection of excess stress, overwhelming our stress handling systems. PEA is a root cause, big piece I'm finding in the research now is what I keep looking for is, we see the smoke fire and we see all these things, and we keep trying to go closer and closer to the root causes. And so we narrowed down to the hypothalamus about 30 years ago. Now we're narrowing it down to PEA as one key piece, but we get closer and closer.
So would you say that for all of these, in order to regulate that hypothalamic area, and then that would support your thyroid function if you're not, the balancing of the TRH, TSH, T4, T3, and then MCAS. So if you have a mast cell, if you're just sensitive or reacting to everything, and it doesn't even have to be food, it could be, allergens outside, and then dysautonomia, POTS, as well as pain, chronic pain, and even fatigue. Is your recommendation that you do a PA support plus the SHINE protocol?
I'll tend to go with SHINE as the overall thing. I'm going to make sure they're sleeping. And you can do that with a sustained release melatonin. There are herbal mixes like True Vitalizing Sleep Formula, Terrific Z's. Some people for falling asleep, the Ambien and other medications have their issues, but they can be helpful. Throw a bedtime can be very helpful, or doxylamine. There's a mix of really reasonable herbals, natural medicines, nutrients, and you can get people sleeping for 8 hours a night. For the hormones, again, it's funny. I was lecturing at the World Fibromyalgia Conference in Italy back in, I think, 1997. Uh, and Bethard Meek, who was the main researcher on TRH and TSH in fibromyalgia, was lecturing. And I asked Professor Meek, is TSH a reliable test in fibromyalgia? And he said, absolutely not. You know, he's right. It's a useless test in fibromyalgia. You need to adjust based on symptoms for the thyroid. So I'm going to address the hormone. And people get hangry, they get irritable when hungry, or they have POTS. I'm going to address adrenal function, adrenoplex. Nice simple mix of like 7 different things. One a day, smooth that out, can help a lot of people. I'm going to address the POTS. If they fail the POTS test, this free test. Then I'm going to look for infections. Do they have candida? I don't do any tests for that because they're not reliable. I look, do they have chronic nasal congestion, postnasal drip, irritable bowel syndrome, gas, bloating, diarrhea, constipation? Do they sugar crave? Not
Right.
irritable, what I call the happy Twinkie hunters. The low adrenal, this feed me now or I'll kill you, where the, candida sugar craving and the yeast want to get fed, they put out something and you're going to the cabinets. It's called the happy Twinkie hunter. It's just like something we eat. Those tell me to eat the candida. And then so those are the infections. Epstein-Barr reactivation, Valtrex and Celebrex, or Famgar and Celebrex, very helpful. I'll go with nutritional support first, because you get your immune system working with a good multivitamin. I like the energy revitalization. Drink mixed powder is great. That's one drink, and people are covered for both all these things at optimal levels. It's just simple. You get your immune system working. Nutritional support. You have the vitamin powder. I'll use a high absorption CoQ10. I use HRG80 regimens. We did one study of 181 people, fibromyalgia, the regimen increased, but you need this high absorption one. So again, the cyclodextrin, HRG80, 61% increase in energy on average. So there's simple things. And I look at each individual case. I see what are the key things they need. Then once I've addressed shine, if they have chronic pain or mast cell activation, if they're on PEA, and these things take about 3 months to fully kick in. And then you see people getting each other.
Okay, and you do it in the order that you brought up, so sleep first, then adrenals. I know it's going to be individualized, but
It's going to be individualized. I'm going to get them sleeping and put them on the vitamin powder first.
okay. So that sounds like sleep and nutrition. But let me ask you a little bit about sleep. So I don't know if this is controversial, but I'm on the fence about melatonin. I know people say obviously melatonin does things more than just allows for sleep. It supports circadian rhythm. Melatonin also supports MSH levels, so the master hormone. But it is a hormone. So I always wonder, and this could be for all bioidenticals, if we take too much melatonin, will it drop our own body's ability to produce it? And then if we also depend on like the Benadryls, we have people in our practice that also uses Benadryl to go to bed, but they've also tried to wean off it. And that last dose makes it nearly impossible for them to just have the regulated sleep they get with Benadryl. Is there a way that we can maybe use the supports, medicines, what have you to sleep so that we can start having the immune system be able to be stronger and robust because of sleep, but get off these meds long term?
So, Judy, this is the key question. You're going to the core of it here. So, with melatonin, when it first came out, all our body makes is about 3/10 to 1/2 milligram of melatonin a day.
Okay.
All it makes. So, when it first came out 30 years ago, a little more than that actually now, I told people limit it to the zero 0.3 milligrams if you need it, because there may be reflex control systems, just like thyroid or adrenal, give too much testosterone production. And it may be toxic. Too much thyroid or adrenal. When cortisol first came out, everybody said, this wonder thing cures everything, until people got Crucigoid, they got poorly toxic and too much. So yes, there was the same concern.
Okay.
I've been following the research looking specifically for those two questions that you're asking. Does it cause toxicity? Does it cause suppression of your own production? And in the 30 years, I've not been able to find any studies showing that. That's why I've been going from the 0.3 milligram dose I recommended to 10 milligrams sustained release now. There's been no evidence, and I keep looking, or it's suppressing our own production.
So the people that get to the 10 milligrams of melatonin, do they ever need to increase it because it's not working? Like the body's just absorbing it now or getting used to it? Okay.
Now we don't see it's called tachyphylaxis, where they get tolerance to a certain dose.
Yes, yes.
The trick with tachyphylaxis, because it's common in this disease, you sleep things and they work for 3 days
Yep.
and then they stop. Um, there's two key components to that. One is that the body just adapts to it and it doesn't work. In those cases, I will help take it 3 to 7 days, however long it takes till it stops working. Then I stop, I switch to something else. And then I do that for a week, stop it, switch to something else, and then rotate
Okay.
back to the beginning again. But there's a second piece too. We have two different phases of metabolism for many medications, where when the body is new to something, it often kicks in this high thing, and then a little bit goes a long way, and then the body learns, oh, this is something foreign, and it learns tricks, and suddenly the blood levels go down, and then you need to up to a different level. For many people, it's those 2 steps, and they get to a stable level, as opposed to some people who just develop tolerance and it won't help.
The people that get on, sorry, I keep pressing this, but I'm just curious. My brain just goes to, fine, okay, I get it. We have to get to 10 milligrams of melatonin because that's what it'll allow us to sleep. But then if we do the adrenals, the hormones, all the rest of the stuff for shine, we get to MCAS, we get to Epstein-Barr, we get to all of that. Can we one day get off the melatonin? Because that's my hope.
Well, yes. So here, thank you for reminding me of this, that other piece to your question. So what I found in the initial double-blind study we did was at 3 months, people had an average 75% improvement. At 2 years, it went up to an average 91% average improvement in quality of life. And by that point, most people were able to wean off most of the treatments. But here's the thing. If you can get to the root causes enough and clear the stress and restore the hypothalamic function, after about 3 months of restoration, it's like crutches. It's able to take over on its own. You can start throwing away the crutches. Okay. But in some people, for example, some with an infection, we can't get to this drive again. Then they're going to be continued support. So if I can get to the root cause and set them back in balance, their body will take over and they can get through the treatments. I do recommend something for sleep long-term in this population because they tend to have more sensitive circuit breakers. And even though I'm moving them away, there's a cliff they fall over with stress. Even though I'm moving them away from the edge of the cliff, it just staying on the multivitamin. So the American diet sucks because it's really losing half of our vitamins and minerals and food processing. It's not an exaggeration. It's fully half. And most people need nutritional support. My point of view, I know there's many points of view with them. That's okay. So I want them to be on a good multivitamin and something for sleep, maybe. Not necessarily melatonin, chamomile tea each night.
Okay.
Not the tea bags, but the buds, not the loose tea. And that's just for, it protects them in the face of stress so they don't trip their circuit breakers easily.
Okay, so fundamentally, it sounds like sleep is super key, which we all know. And if you're not sleeping, you're not going to have the body's ability to even strengthen the immune system. You're going to wake up with more cortisol. You're going to be craving the stuff that's not good for your body, and then you're not going to be able to handle stress as well. And then all of those downstream effects. Additionally, nutrition is super important because how are you going to feed the raw materials to your immune system to even fight the good fight? Totally on the same page with you. One thing that we are running into in our practice is that people have Epstein-Barr, people have chronic Lyme, and some people, they have the immunoglobulin or the IgGs in their system, but it's sort of downregulated. It's not super high. And they've never felt chronic Lyme symptoms. I'm kind of bucketing Lyme and EBV, but basically feel the full effects even down the road. And some people, they never get diagnosed with Lyme, or they didn't even know that they had EBV. And I always thought maybe these people are just, their immune system's a little bit more dysregulated. It's not as strong, and maybe they need the SHINE protocol. But what is it that some people get the full-fledged chronic Lyme and never have their health again, or until they do other protocols? And some people get Epstein-Barr, which I think 98% of the world do, but some people are still sick from it.
Let me tease these out as 2 separate infections.
Okay.
You'll see for many infections, part of the evolutionary toolkit of those infections, we saw it with COVID again, is that they cause the immune system to shift in a way that allows a jailbreak of Epstein-Barr virus, called Epstein-Barr reactivation. There's some viruses, like herpes viruses, Epstein-Barr, that the body never completely gets rid of. That's why with shingles, you'll see somebody had chickenpox, and 40 years later, the shingles, the virus escapes and gets shingles. Why that's the case, we can theorize, but it is so. And certain infections, many infections, will trigger the Epstein-Barr reactivation. Then, once you get the immune system back in check, the immune system can take care of the jailbreak, put all the viruses back away where they belong, and you take care of it. Now, in some people, the immune system can't heal enough because of the Epstein-Barr virus. And on that small subset, maybe 20 to 30%,
Okay.
I'm going to go with the 6-month protocol, actually, of Famvir. It's worked at Bridget, very nice research on Famvir and Celebrex combination. You need the two together, and that very nicely takes care of that group of viruses. His study was looking at ASSV1, but it does the same for the EPV. I will note that the antibody testing is useless.
Okay.
And I can give you graphs where for people with CFS, where they're given, Epstein-Barr IgG and the early antigens, I am more likely going to be, look, have you not responded to shine, where your body is, are you still getting flu-like symptoms, especially around the flaring or symptoms? Did your illness begin with a flu-like illness or viral illness? In that case, and you're not better, I will go with Fanfir Celebrex. So that's the antiviral. Let's look at the antibiotic sensitive. There is no test that I consider reliable for chronic Lyme disease.
Okay.
The standard major lab tests will miss, how the British Medical Journal call it, the test we know about it, no coin. They're that unreliable. They will miss most cases of Lyme. The holistic testing, I think I've seen 2 negative tests in my 30 years, 50 years, holistic medicine now. They, in my humble opinion, they have a problem in terms of specificity.
Okay.
Where if 95, if you check a bunch of healthy people and they're positive, that test does not have good predictive value. So that they continue to have a positive Lyme test. Or Epstein-Barr, 95% of people are going to be positive. 95% of the healthy people are positive on the IgG antibody because we've all had it by time we're adults. For the Lyme, I find it more helpful to look at antibiotic sensitive infection. Does the person have a history? They certainly have symptoms suggestive of Lyme, not suggestive of fibromyalgia, but if they have the vertigo, which suggests to be not dizziness, but vertigo, antibiotic sensitive infection. Paresthesias, no, 44% of people fibro have numbness and tingling. That's not Lyme. But if they have other severe neuropathy, there's certain symptoms some people leave me thinking Lyme disease. But here's the key thing. If they say, yeah, I had this dental work and I went on the antibiotic, my CFS and fibromyalgia went away for the 2 weeks I was on the antibiotics. And almost always they say, well, what happened when the doctor put you back on the antibiotic? And I said, they wouldn't convert. Boggles my mind. A crippled person, oh, we can't give antibiotics long term. I have acne. Oh, sure, here you go. It's like, I as a doctor, it just blows my mind. But if they have an antibiotic response, they took an antibiotic and the Lyme got better, or disease got better, then that tells me it's an antibiotic sensitive. I don't need the label of whether it's Lyme or different. Why then does it stop working? One, because the continuing chronic Lyme is often just the circuit breakers, the hypothalamic dysfunction. The Lyme is often gone, but they've triggered a secondary candida from the antibiotics. And paradoxically, when people are on antibiotics, the candida symptoms go down. And then they stop it and it goes way up. People are used to yeast infections from antibiotics. But they think about vaginal, not the sinus, not the body-wide kind of stuff. So I find that for a lot of these chronic Lyme patients, I treat the shine, and if they have severe sensitivities, I look at mold toxins, not mold infections, but the mold toxins. And for those that are interested, who are considering mold toxins, you can ask me for the chapter on mold toxicity from my book, which I call Everything is the chapter name. And I'll give you a detailed thing of, again, the testing is not super reliable. It can be somewhat helpful. I strongly recommend Neil Nathan's book, Toxic,
Yeah.
for those of you with mold toxicities. He is usually quite, we don't always see the eye to eye, but I always respect him. In my book, I talk about the symptoms that suggest antibiotic sensitive infections, symptoms that suggest mold, symptoms that suggest viral.
Okay.
If your symptoms suggest antibiotic sensitive, scalp scabs. Zithromax helps that population in terms of the whole fibromyalgia. There are all these different symptoms that will tell you, I will treat the 6-week empiric trial of doxycycline or other antibiotics, whatever helps in the past, I'm going to go with that. If they get better, I will give them the diagnosis antibiotic sensitive CFS or fibro.
Okay.
Don't need to break it down further because I'm fooling myself if I do.
Okay.
No. And I can give you tests that'll be positive on you, on me. Hey, we have a positive test. That doesn't tell me anything because it's positive on everybody.
Okay, so if somebody is falling into the CFS that seems to improve with an antibiotic, instead of defining it as Lyme because there aren't the best tests out there, and most tests, the holistic medicine versions are share a lot of false positives, and then the standard care versions, there's a mix of both, like a lot of false positives and a lot of false negatives. So I could see that. So that's why you don't go down to chronic Lyme. But if you look at Lyme and you look at it only from an herbal perspective, could we just throw in cat's claw or artemisia or any of those herbals? Like, what are your thoughts with those?
Absolutely. You can throw Ostevia, you can throw berberine, you can
Yeah.
throw in all kinds of beet propolis. There's so many
Right.
that are very, very helpful. That's what in my books I'll talk about the mix of both the natural and the prescription. I'm not, I like the whole toolkit.
No, that's fair.
I comprehensive medicine, I think it's a good name for what I like to do. It's you look at the science, you use the best of both worlds. I will say that most of what they're called medicine is not science. It's labeled as that. It's really slick pharmaceutical advertising masquerading as science. And one needs to be able to have discernment and tear a study apart to see what it actually shows. Stevia, raw stevia can be helpful, or it be Lyme or other infections. There's so many things that can be done. But I'm not averse to whacking it with the antibiotics also, as long as I'm covering for the mold secondary yeast infections at the same time.
Yeah, let's talk about mold. So I actually became a proficiency partner under Dr. Shoemaker. That's sort of my headway into mold or SIRS. And so I have come to the conclusion that no one has the perfect answer because first of all, everyone's individual story is different. I'm curious, what are your thoughts and how important is treating mold mycotoxins that are in your system? We know that Candida persists even with the reduction or removal of all sugars. So the beauty of the carnivore diet is it tells you a lot, even if it's not the final answer. And what we found is there's people that eat a carnivore elimination diet, super strict, meat only for 3 years, not even dairy, and they still have candida. Oh, the mold in their system or exposure is feeding that fungus. Thoughts on mold in general and how you treat it?
So, Dr. Shoemaker, if you take a look at what Neil Nathan took Dr. Shoemaker's work, my work, the Flaken work, and a lot of others, and he has distilled up into his thing. So, Dr. Shoemaker, we have fun conversations and also don't see eye to eye on everything, but I think he's brilliant. I think he's a really good man. I think Dr. Nathan has taken his work and made it easier to understand and more applicable for people in the toxic. But here's a distinction that needs to be made between mold toxins and mold infections.
Okay. Yes.
Not the same thing.
Fair.
So the candida, and I use candida loosely for mold infections, will cause nasal congestion, irritable bowel syndrome, sugar craving, non-irritable sugar craving. It'll cause a whole pain and fatigue and brain fog. But that's what tells me, and I'm going to go with the diflucan, Sporanox, or propolis and berberine, and I'm going to go with a low sugar diet. I don't go with a low candida diet. It's not a candida allergy, it's a candida infection. It's not feeding them. But I'm not going to cut the yeast out of the diet. So that's infection, and I'll know diflucan for 6 weeks. That's going to tell me that, plus, the whole thing I see get better. Then you've got the toxins. The toxins, especially since they tend to be made by mold in the sinuses, seem to be able to get to the hypothalamic area. I don't know. I'm speculating that the proximity makes a difference. But what you're going to see are sensitivities for the hallmark of that. Because again, if you're stimulating that area, you're going to get histamine release as the PEA completes. So you're going to get that. You're going to see co-infections like Bartonella. You're going to see more POTS dysautonomia. And I don't start with mold toxins just because that's a Pandora's box where you're saying, okay, you're going to have to like destroy your house. With his $50,000 charge for renovation. I would rather go ahead, or more. I'd rather do the SHINE protocol first. There where Dr. Shoemaker and I are pals. I would rather do the SHINE protocol first for 3 to 6 months. If they have a lot of symptoms of the mold, yes, I will get the binders and I will start with them. There's a wonderful sinus spray, this compound of pharmacy called ITC Pharmacy I talk about. If you have mold, you can ask for the mold information sheet for treating the infections naturally. That can control the infections as well as works on bugs at the same time. It's cheap, it's molds, it's really good. So usually I'm going to do SHINE first before I open the Pandora's box. I'm going to treat your reactivity to the mold toxins before I treat the environment, because that's very expensive. And there's no consensus on how to do that, or when it's done, if symptoms persist, you keep, maybe have to tear the foundation out. Yeah. You know, where at what point do you go on and look for other things? So I'm kind of in between.
So before I fell into the mold space or biotoxin space, we always use carnivores and elimination diet. So strengthening the body, making sure that you can use enough nutrition from your quality meats that will support the body, reduce the inflammation, and calm down the immune system from all the inflammatory foods that we're eating that we can all agree on, that eating GMO foods sprayed with glyphosate or eating ultra processes with, like you said, nutrition stripped, and then we add fortified vitamins, which aren't always the best because you can use the cheapest versions and the FDA does not care. And so we use that. And then we learned about mold and how, and then as you said, Dr. Shoemaker's first part is get out of mold. And I think it really depends. Then we started having a subset as we started sharing about mold that people were like, let me bypass the diet, let me bypass gut healing, and let me go straight to treating mold. And so people would get on a binder and maybe they would remodel or renovate or remediate their house. And we started noticing that I thought, okay, fine, it's just a fast forward process to getting out of mold and then treating mold because that's the root cause. And we found that a large subset, because they didn't do all the earlier stuff of like your SHINE protocol, the drainage, the lymphs, the support, the mind body work, the proper diet and sleep, they didn't heal enough. And then when it gets all mixed up, is it the environment or is it your body is not strong or robust enough? And so I am more on the same page as you. I still think it's important to address mold or address, like you said, if you find the right root cause answer, your SHINE protocol should work well enough. And then eventually people can start taking off whatever supplement or medication they're taking. Totally on the same page with you as that, as we have found that if you don't strengthen the immune system, you may need a pristine, not a single mycotoxin in your home. And that's unrealistic because one water damage event, one time your toilet overflows, you're done. And that's so unrealistic. But if you can strengthen your body, we have to expect there will be some level of mold that we're going to get exposed to even outside. And if your immune system is strong enough, we've lived with that for so many hundreds of years.
A way that people can understand this more easily is, number one, you're in the zone, and you have some people that will do tests that are positive for everybody, and others negative. Again, testing is an issue. But what if everybody, you have 5 people living in the home with you, and you're the only one who sent them to you and one other person? It says that you can get your body to where your body can coexist comfortably with the mold, because the other 4 or 5 people in the home have. Right. On the other hand, if you have a house where everybody's having nosebleeds and toxin symptoms and the rest, then you know that it's a sick house.
Right.
But if it's in the middle where not everybody has that, then you can adapt the home and clean it up a bit, and you can adapt your body and stress that best.
Yeah. And I think we both are on the same page that your home should be taken care of at a certain point. I mean, you shouldn't live in a house that has water damage or active water damage. That's not good for anybody's health. But I think strengthening the immune system and reducing inflammation is so imperative. And so I love that what you're sharing.
I mean, if the sensitivities are a major issue, then I'm going to start with the mold. And I'm going to start with cleaning the mold inside the body. The mold producing, these toxins are being made off by mold in the body. I'm going to clear that,
Right.
you know, because of go the antivirals. It really tailors to each individual. If they have hot symptoms, go on the compression stockings, increase your salt and water, you know, do the adrenal support that's indicated. It really is a sort of tailored thing. But the PEA, if people have mold issues, if they have sensitivity issues, if they have pain issues, more and more to start with the PEA and, you know, use the high absorption form, the health information response, take it in the higher dosing for the 3 months, because if you're that sick, it's worth just going with the higher dosing. Beyond that, again, multivitamin and sleep, really good place to begin. You don't sleep, your pain is not going to go away. It's just basic. If you have nutritional deficiencies, the pain's not going to go away.
In terms of hormones, do you see that the thyroid hormones being balanced, or like the sex hormones, cortisol hormones being balanced, like that matters more? Is it just
All of the above? It depends on the individual. I have people, I'm routinely going to check a TPO antibody, and if it's positive, it's going to thyroid. And if they're thyroid, achy, weight gain, cold intolerant, 2, 3 of those mitigate thyroid. I'm going to adjust it to dose of fuel best. If they're hangry, I'm going to give adrenal support. You know, if their symptoms started with perimenopause or worse around the menses, I'm going to give them bioidentical hormone support. Again, the symptom patterns kind of tell me where to begin.
right?
But for anybody with chronic pain, you know, the curcumin of PEA for pain, it's anybody with pain, you know, they start with those 3 months, and most of you are going to find the pain gets much better or goes away. And the multivitamin and extra revitalization drink mix. You do those 3, you're covering a lot of it. And people are surprised at how their chronic pain is not chronic anymore. So it's, again, there's places that again as a general thing, but the tailoring, I'm going to do a shameless plug. My book's fantastic. We'll kind of walk each year through how to recognize cells, each of the different symptoms. Are they a thyroid dominant problem, adrenal or other hormone? Do they have mostly yeast? Do they have antibiotic sensitive infections? Are they viral? It helps. You don't need to do it. The information sheet that I'll send out will give you good starting places in terms of nutritional support and things that'll help. There's things that are just general to the sleep nutrients. Makes a big difference. And as you found, high protein diet, you know, everybody needs this diet. They're all different. But for this illness, fibromyalgia, high protein is most commonly the one that's going to keep people feeling better. So, you know,
Why is that?
poor diet, because you're going to see a couple things. One, the carbs tend to feed the yeast.
Okay.
2, with the adrenal issues, you're going to have tendencies to keep going into low blood sugar. Protein diet tends to give you more stable blood sugars during the day. Growth hormone tends to be low in this disease because it's a hypothalamic function hormone. And so you're going to see all these different things tend to be predisposed to feeling better with protein.
You mentioned in several of your writings that sugar is just really, really not ideal. You just touched on a little of it, but do you want to expand a little bit about why sugar? I mean, there's fads where I think there was a fad not too long ago that the sugar diet was so popular, so just eat nothing but sugar. Doesn't matter what kind. And there's diets where people say it's not the sugar that's the issue, it's just the seed oil. So as long as you don't touch a single seed oil, you can eat enough sugar and you'll be fine.
Well, let me give you the answer for everybody. How does it work for you? We're all different. We all have different needs. We all have different strengths, sensitivities. Try it out and see how does it feel and how does it work for you. Now, I can give you heroin, you're going to feel a lot better for about 4 hours. Then after a couple of weeks, you're going to find it doesn't work very well for you. Sugar's not like that. It'll give you a quick energy high. That's why using sugar as a placebo is an active placebo. It's not a good idea in fibromyalgia trials. But how does it feel? What I believe your feeling does, and then check over time how that's working for you. That's the best way. Some people do really well with a vegan diet. A lot of people crash and burn and are sick as can be with a vegan diet. Everybody's different. I tend to be more carnivore kind of diet kind of guy myself, and never let a steak I didn't like. It's like my body feels better with it. Uh, let your body guide you. There's no one diet for everybody.
Yeah, I feel like some people, their struggle is so they hear about a carnivore diet, it's going to heal, or just a highly reduced sugar diet and removing processed carbs, and so you don't get to kind of partake in the celebrations, the happy hours, and the thing is, though, for many people, maybe their pain doesn't go away enough, so then they start feeling sorry for themselves, and they go through this path of, well, if I am not having a great reduction in pain and I'm not sleeping as well, then I might as well just eat whatever I want because the pain is still pretty equal. And I feel like that's why a lot of people end up going back to the foods that aren't so ideal.
Well, what I found, there's some people who need a very strict no sugar diet, but that's a very small percent. For myself, for example, my wife has not had a teaspoon of sugar in over 30 years. Um, that's added. Where with myself, if I'm out with friends, we'll get one, you know, dessert to die for kind of a thing. And I'll have one or two spoons, and that's okay. Because one or two spoons isn't what that's the and that's where you get 80% of the pleasure is the first two bites.
Mhm.
But then you want to inhale the whole rest of the cake, and that's what crashes you. So take a small little bit, walk away from the serving table. As long as I have a little piece in my hand, I can walk anywhere in the world. My willpower is easy to cover right there, and then I can savor it. Where if I'm standing right next to the serving dish, I inhale the first two bites, I don't even taste it, and then I'm taking two more. It's okay. Have it without guilt. Take a little bit, walk away from the serving dish.
Right. I think it goes back to what you were saying. You have to figure out what works for you. For me, when I was trying to do a carnivore elimination diet, initially I tried to band-aid with sweeteners and even diet sodas. And that ended up making me go back to real sugar. So for me, I had to just abstain and it worked. But not everyone's wired like me. Like you said, you can pick the two. Like I would probably just take two and then go back and then keep going back. So I think again, it's really individual and it really just at the end of the day, you have to know what works for you and then try to do that. But we just have to think of it as the more that we eat processed foods or foods that aren't supportive of our immune function, it will make it harder to heal from whatever symptom and chronic illness that we have.
No, listen to your body. Yes. One last thing. If you use all the information that Judy and I gave you today to get your body feeling better and working better, and you use that so you can go back to doing what made you sick that you hate in the first place,
Mm.
your body will find another way to take you off the game. Your body has forced you out of something, a situation that wasn't working in most cases. Notice the things that feel good to you, not what your brain's saying you should do. Brain's going to shit on you all day. Should do this, should do that, should do the other. Ignore that. See how it feels. See how it works out for you. And start divesting those things that feel bad, that are toxic to you. Then your body will stay healthy as you improve these things.
Are you talking about lifestyle things? What specific? Okay.
Talk about relationships. I've talked
Right.
about work. I've
Thoughts.
talked
Yeah.
about the things you do. We are raised with what we should do to get approval. This is an approval seeker's disease. People who look to others for approval instead of being self-validating. And basically, we land making everybody happy with us. And this doesn't work. That's the way to drain energy. To follow your own bliss. See what excites you in life. When I meet people, I don't ask, what do you do? I ask, what are you excited about? It's like that. If you start to tune into that goes a long way towards supporting your health. We talked about the biochemical today,
Right.
about being authentic and following your bliss. Stay healthy and happy.
There's a subset of people that say that autoimmune is an illness that's created because you're not good at saying no or having boundaries. And so your body is now trying to protect you and give you space by creating an autoimmune illness. And I thought that was so fascinating. But I think there's so much with the mind body that is affecting our chronic illness.
For when it comes to the immune issues, the immune is kind of guided by our feelings and our mind. It doesn't know what's happening in the outside world. It knows how to tell a bug or bacteria or a wound, and it can tell that. But it takes its cues from, do we feel safe or do we feel threatened? And if we feel threat, the immune system goes on alert. And when we're consciously feeling threat, like we live in an environment, when I was your age, the media opera was sex sells. You wanted to sell something as the advertisers put a good looking gal or a handsome guy by the car or the beer. The advertisers sold stuff. Now it's ear and device themselves. We live in an environment where the media, and God bless them, for some reason they still come and quote me every day. And sometimes they correctly, although most often it's not like they make stuff up. And they're nice people, they're all nice, but what they're saying is utter rubbish. I know firsthand. I know because I'm quoted. And I know the science. Most of the stuff in the media is trying to scare you to death and make you hate each other. And that puts your immune system on high alert. Turn all that stuff off. Find things to focus on where you feel safe. And let your immune system go into something deep state, whether it's meditation, prayer, being in nature, music, whatever it happens to be. Let your immune system know where it's at as well. It will stand down. And a lot of this autoimmune and hyperimmune followed by immune exhaustion cycle settles down. It's like a child is taking its cues from its parents as you. Let it know you're safe because you are. Especially if you can honor your boundaries and say no to things that come out.
I love it. Thank you so much for your time. Where can people find your book? So should people read your book first and then reach out to the specific handouts? Like, what do you think is the best thing?
Again, people have a bit of a short attention span these days. My book is more of a textbook. So, email me at fatiguedoc, FATIGUEDOC at gmail.com. Ask for the specific sheets you want. And then that'll give you kind of the short and sweet version, at least shorter, version. And then if you find that appeals to you and you want more information, get the From Fatigue fantastic book. It'll go through all these things, including the mind-body components, including the PTSD, how to deal with those, release those traumas. That's all covered in it. If you feel like it, get the book. I retired after 50 years, so mostly I'm teaching now, so I don't do the direct patient care anymore. Okay. My newsletter coming out this week is on how to find a practitioner. There's, it's a challenge, but there are many good ones. For supplements that I talk about, they are available at endfatigue.com. Okay. And like Nancy, D like David, fatigue.com. They're also available in most health food stores, Amazon, and everywhere else in the world. For those of you who are overseas, shipping to the United States, there's a company called iHerb that carries most of the things I talked about, and they are a big enough company. They have really good shipping rates. I have no connection with any of these. So this is just how to find stuff.
Okay. Well, thank you so much again. It's incredible that your journey has given you this desire to help other people, and I love it. Thank you for, these protocols, because not everyone can work with a practitioner. So if you make it as simple and a handout, then they can get it and try to heal themselves, because no one wants to be sick.
Aloha, everybody. The big island of Hawaii.
Okay, guys, I have some work to do looking more into PEA, and I hope that you guys also take the time to learn about some of the areas, especially if those are areas or symptoms that you are dealing with and not getting better. As I've said on this channel several times, hormones or thyroid is not a root cause issue. Sure, maybe we need to take BHRTs or maybe we need to take thyroid hormones, but we should always get to root cause. And as Dr. Teitelbaum says, the SHINE protocol can support you into getting more closer to root cause healing. Now, there may be other things that we have to do after that, as he also brought up, if you still have an active infection or if you're living still in mold. These things will impact your ability to fully heal, and if SHINE protocol is not working enough. The key is that if you are proactive, you can have answers and you can get to root cause healing. But not everything is thyroid. Not everything is blood sugar dysregulation. Not everything is carbs or no carbs. And not everything is seed oils or food dyes. Oftentimes, there is something more upstream that may be dysregulated that then may cause you to be more sensitive to the glutens, to the food dyes, to the other things that are toxins in our world. And the overall bucket of toxins then makes us feel unwell. I wish that chronic illness was just seed oils or just grain-fed meat or just whatever the new flavor of the week is. I think it's plastics lately. But usually there is something more upstream, something that may be impacting your brain that then affects everything else. Our body is one big system. And if we understand that if a symptom is occurring, that is a big clue into what can be happening. And just because we test our thyroid and our thyroid is low or our TSH is high, that does not mean that the root cause is just thyroid. And like Dr. Teitelbaum said, you can take thyroid meds and feel better for a short bit, but so can sugar and so can cocaine. All of these things can make us feel better for a short bit. It can be a stimulant. But if long-term, the thyroid meds or the hormones or said medication is not making you feel better long-term, including a diet, then we know that there's still more digging to be done. And I know that digging is not fun and not easy, and it's sometimes expensive. But I hope that these conversations give you answers or the next path forward for you to get to root cause healing. But I think the key takeaway is there are always options and there are always ways to get to root cause wellness. Okay, guys, make sure to eat a lot of meat. Take care of your bodies because it is the only place you have to live. I will talk to you later. Bye, guys.